I'm Jenny Daniel. I am the owner of My Nurse at Home, and I am an experienced oncology nurse. And I am going to talk to you today about nausea and vomiting and how to manage this at home. Nausea is a sick or like queasy feeling in your stomach. Vomiting is when you're actually throwing up, and it often comes along with the nausea. Many things can cause nausea and vomiting, along with the cancer. It is pretty common to experience some sort of nausea and or vomiting during your course of treatment. So, just to talk about the treatments itself, chemotherapy is a pretty common cause for nausea and vomiting. Radiation, being that I deal with generally breast cancer patients, not as common to experience nausea or vomiting. Radiation would tend to be caused for nausea and vomiting if you were getting radiation to the brain or to the abdominal area. But anxiety can be a big cause for nausea and or vomiting. So something to kind of watch out for. There's a lot that you can do to prevent or better manage your nausea. Drinking 6 to 8 glasses of decaffeinated fluids per day, like broth, Gatorade, Jello, fruit juices, water ices, popsicles, decaffeinated soda, ginger ale. Eating dry, bland foods like crackers, toast, cereal, pretzels, ginger cookies. Eating cold foods like cereal, salad, cold cuts, desserts. Sometimes the smell of hot foods can actually make the nausea worse for patients. Also, instead of eating 3 large meals, eating 6 smaller meals. Eating small and frequent meals can actually help keep the nausea to a minimum. Chew your food well. You can try peppermint or ginger tea. That often helps, or have others help prepare your meals. Rinse your mouth often using a baking soda saltwater rinse. That really helps to avoid any unpleasant and sour tastes to your mouth. You can suck on mints like hard candy or ginger candy also. Loosen your clothes and get fresh air after you eat. Sitting upright for 1 to 2 hours is also recommended. If you're having a really tough time with nausea, breathing slowly through your mouth can also really help. Getting your mind off of the nausea also helps. So you can watch TV, you can listen to the radio or listen to your favorite music, play games, anything to kind of distract. So using relaxation techniques like visual imagery, hypnosis, acupuncture, things like that. Things to avoid, I would say greasy, spicy, fried foods, very fatty foods, citrus fruits, juices, tomatoes, anything that you consider an unpleasant odor or sight or sound. They can all make your nausea worse. If you combine hot and cold foods at the same meal, that can sometimes make things worse. And also avoid your favorite foods during real strong bouts with nausea and vomiting, because you may associate them later with that and then not enjoy them as much. Some patients will be treated with anti-nausea medications to be taken before and after treatment. If your nausea is constantly occurring during your treatments, then they may give you medications to take on a regular basis, including even before bed. You can also get anti-anxiety medications if your anxiety is what is causing the nausea to be even worse. If you become really dehydrated as well from nausea and vomiting, your provider may send you for fluids to help, and you can get those through an IV. Things to know about calling your team, your care team. If you vomit and it looks like blood or coffee grounds, if you have black stool, if you have a temperature over 100.4, if you vomit more than 2 to 3 times in one day, if you have trouble eating and keeping food down, if you can't drink at least 6 glasses of fluid in a day, if your urine is so dark it looks like darker than an average tea, those are things that they need to know. Okay, so for you to stay compliant, it's really important. I'm happy to help you along your journey. So just reach out to me and send me a message through social media or my website.